Hello everyone, I am Dietitian Suparna and welcome to my channel. In this pandemic situation, we all are getting more and more health conscious. Here and there, we are hearing about this mineral, that vitamin, this kind of water, that kind of food, etc. should be taken to boost our immunity. Vitamin D is one of the most spoken ones nowadays. As health conscious citizens, we must know what is vitamin D, how it works in our system, how we get vitamin D, and consequences of overdosages also. So, let's start. Basic chemistry. Vitamins are of two types. Some are water soluble and others are fat soluble. This renowned vitamin is a fat soluble vitamin. Vitamin D exists in two forms. Vitamin D3, which is also known as cholecalciferol, this is from animal origin, and vitamin D2, which is also known as argocalciferol, and this is from plant origin. The precursors of vitamin D in animals is 7-dehydrocholesterol and in plants it is ergosterol. The active metabolites of vitamin D actually do the work in our system. The metabolites are 25-hydroxyvitamin D, 24,25-dihydroxyvitamin D, and the most active form is 1,25-dihydroxyvitamin D. Biosynthesis of this vitamin in our body. In humans, the UV rays of sunlight initiate the photoconversion of provitamin D3, which is 7-dehydrocholesterol, to pre-vitamin D3 in the skin. A heat-induced isomerization then converts the pre-vitamin D3 to active vitamin D3 over a period of 2 to 3 days. Exposing the hands and face to 15 minutes of sunlight 3 times a week allows the body to produce adequate levels of vitamin D. Now time to know the physiological functions of vitamin D in our body. The most important function of vitamin D is to control calcium homeostasis in our body and bone formation and its maintenance. 1,25-dihydroxyvitamin D facilitates the absorption of dietary calcium and phosphorus in the small intestine. In the bone, vitamin D acts together with parathyroid hormone to stimulate the metabolism of both calcium and phosphorus. In the distal tubules of the kidney, vitamin D and parathyroid hormone works together to increase the reabsorption of calcium. 1,25-dihydroxyvitamin D itself is not directly involved in bone mineralization, but it does have significant effect on the bone forming cells, which play an important role in the bone formation. Vitamin D and parathyroid hormone together regulate the concentration of calcium in blood plasma. This is important not only for bone formation and maintenance, but also for maintaining blood calcium levels to facilitate the proper interaction between nerves and muscles. One of the most serious disorders associated with vitamin D deficiency is the convulsive state of hypocalcemia tetani, which is caused by insufficient supplies of calcium to nerves and muscles. Vitamin D has two functions in bones. Number one is the control of calcium homeostasis by dissolution of the bone, and number two, mineralization and formation of new bone. Thus, vitamin D helps to maintain bone mineral density. There are other functions of vitamin D other than calcium homeostasis and bone formation. Those are as follows. Vitamin D is involved in the regulation of some specific genes. Vitamin D probably performs some functions required for insulin secretion, the operation of the immune system, and the development of the female reproductive system and the skin. Vitamin D is also known to prevent colon cancer. Vitamin D keeps our gums healthy by fighting inflammation and prevent gum bleeding. Researches indicate that there is a potential therapeutic role of vitamin D in skin disease like psoriasis. Researches also show that vitamin D has potential effects to reduce respiratory infection to some extent. Vitamin D deficiency results in rickets in children and osteomalacia in adults. The severe forms of rickets and osteomalacia with gross deformities of the skeleton are now rare. Minor forms of the disease leading to impairment of bone growth in children and demineralization in adults, especially old people, continue to be found in sections of community in all countries. Ricket is characteristically most severe in children between the ages of 1 and 3 years, often becomes more pronounced at puberty, associated with the growth spurt. Vitamin D deficiency is now recognized in very young infants, which is also known as neonatal rickets, especially those born with low birth weights. It is attributable to a mother being unable to supply sufficient vitamin to the fetus or subsequently in her milk. Osteomalacia means softening of bone. It is primarily due to a deficiency of vitamin D. This results in a failure to replace the turnover of calcium and phosphorus in the organic matrix of bone. Hence, the bone content is demineralized and the bony substance becomes replaced by soft osteoid tissue which contains less calcium and phosphate than normal bone. The common presenting features include dull ache to severe pain. The site frequently affected are ribs, sacrum, lower lumbar vertebrae, pelvis and legs, and musculature weakness is often present in patients with osteomalacia. Now time for sources of vitamin D. The best source of vitamin D is UVB radiation from the sun. UV radiation levels vary depending on location, season, time of the day, cloud coverage and the environment. Only the exposed parts of the skin help in manufacturing the vitamin. Here we have a myth about the sun rays. Many of us are told that sunshine in early morning gives us vitamin D, but this is a myth. In reality, research works depict that the wavelength of UV rays between 290 and 315 nanometer is needed to synthesize vitamin D in our skin, and this ray is available from 10 am to 3 pm in a cloud-free day. Thus, sunshine for a 10 to 20 minutes in a cloud-free day between 10 am to 3 pm is ideal to synthesize vitamin D in our skin. Most foods have negligible amounts of vitamin D. Certain marine fishes are known to be good sources of vitamin D. Egg yolk, butter and milk have some vitamin D and can be considered as poor sources. Recent studies indicate that even the freshwater fishes have moderate amounts of vitamin D3 in their liver. In this video, I am giving a list of some food sources of vitamin D with the vitamin D content. Fortification of foods like milk or our staple foods like cereals may be a long-term intervention for prevention of vitamin D deficiency in the community level. In August 2018, the FSSAI had notified the Food Safety and Standards Regulations 2018 in the Gazette of India. With these, in case of vitamin D, India became the third country in the world to allow fortification. Time has arrived to know the supplementing dosage and effects of toxicity of this vitamin. Vitamin D is now considered more as a prohormone rather than a vitamin. Only in those cases where vitamin D requirement is not met through adequate exposure to sunlight or due to metabolic or genetic reasons, therapeutic supplementation of vitamin D may be necessary. Here I am giving blood ranges of vitamin D and when supplementation is needed in a table form. In prescribing medicinal vitamin D under certain situations where there is minimal exposure to sunlight, a specific recommendation of a daily supplement of 400 international units is made by ICMR for adults below 70 years of age, and for 70 years and above it is 800 international units daily. Weekly dose of 60,000 international units for 6 to 12 months is recommended for deficient infants or children. People with more than 150 nanogram per dl of serum vitamin D are referred as vitamin D toxic. Vitamin D toxicity leads to calcium accumulation in the blood that is called hypercalcemia. First symptoms include loss of appetite, nausea, weight loss, failure to thrive, etc. Symptoms go away as soon as all dietary sources of vitamin D are withdrawn. If hypercalcemia is allowed to persist, it can cause kidney stones, calcification of soft tissues including arteries, heart, lungs, and kidneys, etc., and ultimately death follows. Therefore, you should consult your physician for medicinal dosages of this sunshine vitamin. I have 3 tips for today. Number 1. Dark-skinned people synthesize less vitamin D than fair-skinned people, so more time of exposure is needed for dark-skinned people. Number 2. Less use of sunscreen on hands and neck can allow your skin to absorb more UV rays. Tip number 3 is expose yourself to sunlight at least for 15 minutes thrice a week. So, moral of the story is sunshine for at least 15 minutes can make our health shining. That's all for today. If you like this video, then please hit the like button and share with your near and dear ones. And don't forget to subscribe to my channel. Thank you for watching. Stay home, stay safe. Bye.